After watching this video, you should be able to describe the basics of clinical neurology, taking a patient with a neurological problem and going through the process of generating a diagnosis and differential diagnosis. So let's take a look at the neurological history and the neurological exam and put these two things together to help figure out where is the lesion most likely to be that's causing the patient's neurological problem. Now, when we're talking about the neurological history, what we're getting is symptoms which are subjective data. And what we want to do is combine that with the findings in the neurological exam to collect signs, which is objective data, and put those two things together to help us figure out where the lesion most likely is. Now, when we're talking about symptoms and signs, we're either dealing with positive symptoms and signs, which is extra things that the patient shouldn't have, or negative symptoms and signs, which is something that the patient should have that's not there. And these both are applied to symptoms and signs. Okay? And that helps us figure out where the lesion most likely is. Now, we can divide that into three possibilities for the lesion localization. The lesion could be focal, which is in a very discrete, well-defined part of the nervous system. We could say, look, the lesion's right there. Or the lesion could be diffuse, affecting a functional system. Okay? And those are really the two main possibilities for lesion localization. And if you can't make it focal and you can't make it diffuse, then you're thinking multifocal. But you really ought to be thinking focal and diffuse first before you go to multifocal. Okay? Now, for diffuse, we're dealing with selective vulnerabilities. It's part of the nervous system is selectively vulnerable, and the neuroanatomy knowledge, knowing about structure and function as well as pathways, are going to help you distinguish between is the lesion focal or diffuse. Because if you don't know the neuroanatomy, you really can't figure any of that out. That's why it's so important to know the neuroanatomy and pathways. Now, once you figure out focal, diffuse, multifocal, you really want to know, well, what is the lesion most likely to be? Okay? And that's going to help you figure out what the working diagnosis is, most likely to be, and what are some alternative possibilities, your differential. We'll take care of patients really well as long as the correct diagnosis is on a differential. So it's very important, this whole process, going through localizing the lesion and then going to the next step and figuring out what is this lesion, to figure out these diagnosis and differential and then ultimately treat the patient. Now, in order to figure out what is the lesion, obviously we need to think about where is the lesion most likely to be. And from the neurological history, in addition to symptoms, we're also going to get the time course of onset. Is this an acute, subacute, or chronic time course of onset? And the combination of that and the lesion localization, focal, diffuse, or multifocal, helps you categorize what the lesion is most likely to be, and then that helps again generate your diagnosis, differential diagnosis, and ultimately treatment. And that concludes this video on the basics of clinical neurology.